over time and manifest and drastically change the shape and the size of the organ. It primarily, symptomatically, between the ages of 30 to 40 is the onset for the dominant form. But the big thing to take home with this disease is that there's no continuity. One person's case can be grossly different than another individual's. For example, using our family, Mom, of course, has had one of the most severe forms of this disease. She's had 2 liver transplants, will require a kidney transplant down the road. Her mother, who also has the disease and passed it on to my mom, is 89 years old and only shows signs of high blood pressure now, which is pretty darn good at being 89. As Mom explained, both my sister and I do not carry the disease. So because this is a genetic disease and it does not skip a generation, Megan and I both pose no risk of inheriting it down the road. So our family alone, you see 2 individuals that had a 50% chance of getting the disease, be free and clear. One individual suffer one of the strongest strains of it, and another individual live relatively free from it. It is one of the most common life-threatening genetic diseases in the world. The dominant form affects approximately 1 in 500 people, which equates to 66,000 Canadians and 12.5 million people worldwide. There is no treatment or cure for PKD, and until one is found, it will threaten the lives of every generation. Transplant and dialysis are not considered means of treatment. They are simply an avenue to prolong the quality of life. PKD equally affects men, women, and children, regardless of age, race, geography, and ethnic origin. And as I mentioned, there are the statistics. So this, for us, speaking to groups like this, the town of Richmond Hill and the council that we did on Wednesday, 12.5 million people is huge. 66,000 Canadians is a significant number. The fact that this is a disease that affects 1 in 500 people, but few of you have probably ever heard of this disease, is one of our biggest pitfalls. It's why we come out to these events. Awareness for a disease like us is invaluable. With all of that said, fortunately there is hope. The PKD Foundation of Canada, to which I'm the executive director for, is the only national organization solely dedicated to raising awareness and funds for a treatment and cure of this disease. Our goal, as was mentioned in the introduction, is to improve the quality of life for those it affects through means of research, education, support, and awareness. A big part of our organization, on top of the fundraising avenue, is the support chapters. We have support residencies across Canada from coast to coast. Guest speakers will attend. Medical professionals from the PKD community, transplant surgeons, renal dietitians, transplant recipients. And the great thing to see about with these groups is the patient-to-patient camaraderie. There's nothing, and I think Mom can attest to this, more comforting than hearing from someone that's been in your shoes. This picture, and as bigger as it gets, it seems to get a little grosser. The left-hand side, right-hand side, pardon me, for you guys is a healthy kidney, to which we each have 2. They're about the size of a human fist. What you see on the other side is a polycystic kidney. These can each grow to be 38 pounds and be the size of a football. So you can imagine, at the most devastating form with this disease, having 2 footballs, about 80 pounds of cystic kidney in your system. So when Mom speaks, you know, she's a tall, lean woman. When she had this, her liver was about 38 pounds when extracted. So she looked about 12 months pregnant, not even 9 months, for the first 14, 15 years of my life. These fluid-filled cysts, which you see here, the bulbous on the ends, as they rupture, is excruciating pain. One that I can't even fathom. Individuals that talk about cystic ruptures can only describe it as being comparable to getting a baseball bat to the size of the sternum. You can be down for hours, days. I've known people that have been down for weeks because of cystic ruptures. With polycystic kidney disease, there are 2 forms. The first is autosomal dominant PKD, which is the 1 in 500 statistic. As I mentioned, the symptoms usually develop between the age of 30 and 40 years old. And with this, the dominant form, as a gene carrier, Mom for example, each child that you have poses a risk of inheriting the disease by 50%. So each kid that you have runs a risk of inheriting this disease. The inheritance pattern, just to give you guys an example, the gentleman in blue, you see that there's 4 different possibilities with the gene code. The dominant gene, which you see is on the father's side, can be passed down in 2 different aspects. So there's 2 children that can be unaffected, 2 children that can be affected. The other form is autosomal recessive PKD. This is a far less common strain of polycystic kidney disease, affecting approximately 1 in 20,000. The great disadvantage of this strain of PKD is that it's generally known as an infantile version of polycystic kidney disease. Back when this was originally discovered, infants that were diagnosed with this prenatally did not run a risk or did not run a high chance of survival. The survival rate for infants affected was extremely low. Thankfully, with progress is made in PKD research and the medical community, there's a far greater chance. Individuals now tend to, with the recessive form, be transplanted in their early years. Relying on, I have one individual that I work with, her daughter Ava received a nephrectomy at 7 months. So at 7 months old, she had a kidney removed. She's about to celebrate her 2nd birthday next month, and she's currently in the hospital right now with what they're experiencing to be kidney failure. So what that will mean, she will have the 2nd kidney removed and will be on dialysis by the age of 2. With the recessive form, affecting 1 in 20,000, the parents have a 25% chance of passing that disease on. This is the inheritance pattern here. To take from the recessive, you need to know that each parent does not show signs of kidney disease. They have no symptoms whatsoever on themselves. They each carry a copy of the gene, which you can see here. Each parent this time is carrying the dominant gene. And when they have a child, both of those genes combined create the recessive form, in each child. In addition to kidney cysts, which I spoke of, those little golf ball bulbs, high blood pressure and hypertension is another common symptom. Constant or intermittent pain in the back and lower flank. So our kidneys are located down along the backside. So when you're experiencing pain, cyst rupture, that's where it would stem from. Frequent urinary tract infections and kidney stones are also common symptoms of this disease. A big red flag, in addition to the hypertension, high blood pressure, is a family history of kidney disease. That's usually one of the early detectors and first signs that you have kidney disease in your family. Heart problems and/or stroke are also a possibility. As Mom mentioned, having this disease, though the cysts didn't directly affect her heart, it put a great deal of strain on one's entire body. And as such, with kidneys or liver, it can devastate the entire body as a whole. How ADPKD, the dominant PKD, is diagnosed, as I mentioned, the family history. The patient exhibits several signs and symptoms that we just spoke of. And the early detection, in addition to the family history, high blood pressure, is through imaging. So we're talking ultrasounds and MRIs. Those cysts that you saw will turn up to be a somewhat gray, cloudy area on the image, and that's how the cysts are detected. Both ADPKD and the recessive form can be detected prenatally, so the infant, you will actually see that gray, cloudy area over their kidneys. As I mentioned, when discussing the complications, it's important to realize that each case is different. What one individual suffers from this disease, another may not, or they may mirror it. Liver and pancreatic cyst formation is predominant with this disease. It was the foremost factor to Mom's transplant. She had it predominantly on her liver, but of course it does affect her kidneys as well, which is why down the road we will require a kidney transplant as well. Aneurysms can be caused from this disease as well. Hernias, left ventricular hypertrophy, which is the thickening of the heart muscle, is a common occurrence with this disease, and diverticulitis as well, which is small pouches which bulge on the outside of the colon. So you can see that this kind of affects every system in your body. So when people hear, polycystic kidney disease, they ask, well, why then, does one have a liver problem, or why does one have a colon problem? It's kidney specific, centric, but it certainly has a negative impact across the board. Options for prolonging the quality of life and relieving some of these symptoms. It's important to mention that these, again, are just means to prolong the quality of life. They're not deemed a treatment or a cure. Medicines, diet, and exercise to control blood pressure. Medicine and surgery to reduce the pain. A healthy lifestyle, the obvious: don't smoke, limit your drinking, monitor your exercise and your weight. Antibiotics, to resolve the infections, but again, the likelihood of that doing a complete job in the resolution is not very practical. With mom's bile duct infection, and the bile duct is what connects the donor organ to the host body, constantly was getting an infection, and they were trying to fight it with anti-infection and medication of that sort, but it just kept coming back stronger and stronger, which then led to her liver failing. Dialysis to replace the function of the failed kidneys, as well as transplantation. But again, if you talk to anyone that's dialyzed over their lifetime, it's not a way of life. It's a game changer. It completely throws off what you're used to living. It's a great means to buy time, but it's certainly not a way to live. So we have individuals, and we do speaking engagements and seminars at odd shops here and there and home shows, because it's the awareness game. We're playing the numbers game. And it's shocking how many people will come up to me and go, well, at least there's transplantation, at least there's dialysis. And I would love for them to say that to an individual that's spending 10 hours a week lying down with a needle in their arm, having their blood transfused. It's not a means of living. What are the chances of developing kidney failure? With polycystic kidney disease, the dominant form, 60% of those will rely on either dialysis or transplantation, which is why we closely align ourselves with the Trillium Gift of Life Network. It's why our patients, our volunteers, our board acknowledges the need to increase donor awareness in organ transplantation. In a slide a little further on, you'll see some of the statistics of York Region towns and cities, and they're terrible. They have the worst numbers for registered donor consent. So by doing these kind of things, that's what we're looking to change. Some of the symptoms with respect to kidney failure, you can see, include fatigue, poor appetite, weight loss, muscle cramps in your legs and feet at night, swelling in the feet and ankles, and mild to moderate depression. So that's a bit of a background on polycystic kidney disease, the disease that affects our family directly. And I want to give you just a bit of an overview on the Trillium Gift of Life Network, their initiatives, the Be a Donor campaign as well. Just while I remember, on your desks you each have brochures from the PKD Foundation of Canada as well as the Trillium Gift of Life Network. Brilliant little Be a Donor cards with their web address as well as green ribbons. So, with the Trillium Gift of Life Network, this was created in December of the year 2000 by the government as a means of a central organized registry for organ and tissue donation. Their mandate, of course, is to plan, promote, coordinate, and support activities related to the donation of organs and transplantation. Their mission: saving and enhancing more lives through the gift of organ and tissue donation in Ontario. It's important to know that even in a first world country like Canada, we do not have a national donor registry. They are provincial jurisdictions. So for us, it's a blessing that we have the Trillium Gift of Life Network. They're leaders of the nation with respect to their awareness campaigns. But some provinces, believe it or not, in this day and age, do not have an organization like the Gift of Life Network, like BC Transplant in British Columbia. So it's wonderful that we have organizations like this that are kind of putting the pressure on the rest of Canada to step up. Their vision is to be a world-class leader that enhances and saves lives through organ and tissue donation for transplantation. Some of their values, which I'm sure are aligned with your organization and our organization, is to be an effective, innovative leader in organ and tissue donation and to work in an environment of honesty, trust, respect, compassion, and cooperation. We have to appreciate the fact that this is a very highly sensitive topic to discuss. Even when Mom was having her second liver transplant, we had an individual that comes in when it's getting close to death from the Gift of Life Network come in and speak to us. We realized that Mom was already registered as an organ donor. We obviously fully support it as a family, But the timing, when you're dealing in a situation like that, it's hard to be receptive. It's hard to have someone come in and talk to you and try and get you to think ahead when you're just trying to live in the moment. So for an organization like this, compassion is critical because you're dealing with people's lives and the lives of loved ones and family members as well. The wait list in Ontario, you'll see at the end, there's over 1,500 people currently waiting for an organ in Ontario alone. 222 livers are on the waiting list, 53 hearts, 1,076 people are waiting for a kidney, 61 individuals are waiting for a lung, 1 individual is waiting for a heart and lung, 35 are waiting for a pancreas, 53 are waiting for a kidney and pancreas, 1501 is currently what is on the waiting list, and every 3 days one of those individuals dies waiting for their organ to come in. We've been blessed twice. They have come extremely close, down to the wire both times, but as I just mentioned, some individuals aren't getting it in time, so that list has to drastically change. You'll see here that based on the communities to the number of individuals with health cards, registered donors, out of 181 towns and cities in Ontario, you're looking from Aurora to Toronto, they're in the high 170s for the most part. They're at the bottom of that list. I'm used to slamming Toronto when I'm there doing presentations, being a resident of Toronto, and it was a change of pace to be in Richmond Hill with Mayor Barrow, and they're actually worse than Toronto. So it's a message across the board that's important for people to realize that these numbers have to drastically change. This is something that can impact your family, family of friends, loved ones, co-workers, everyone. If you look at that, right now in Richmond Hill, 11% of eligible registrants are signed up right now to be a donor. There are a number of reasons. Ignorance is a huge one with respect to lack of understanding. People may think that they're registered, and to which that they aren't. The old donor cards, and we'll go through this with, this is just to wrap things up, a few frequently asked questions. Those old donor cards that you used to sign and you keep in your wallet aren't registered. So the new donor consent, which I'll go through, keeps it electronically. It's an avenue for them to be able to pull your request faster. Say you don't have your wallet or your card on you when the time comes. So for people that think that they have their donor card signed, they might think that they're doing everything in their power and they're good to go and they're ready. The new consent means that you still have to register, and it cannot be any easier. The Be a Donor cards that you guys have, if you go to beadonor.ca, I was with a friend at the doctor's office, and in 45 seconds on her mobile phone, she was able to register her consent. You simply just go onto their website, as user-friendly as it gets, and you plug in your health card or your driver's license, and it will tell you the status of your registry as well. So if you're even, I think I did a couple years ago, that kind of thing, you can go on and know the answer and change it within minutes.
So Jeff, do they send you a confirmation?
That's a good question. Now I do it, well, I've done it when I've gone to change my, or to renew my health card. So you do it on the spot. And then when you print your health card, you'll see it on the back. So that's the greatest confirmation. When you do it electronically on their website, I'm sure that it will take you to a confirmation page. But that's a good question, and I'll certainly be able to get the answers to you guys. As I mentioned, the donor card is a means to, through the Ministry of Health and Long-Term Care database, that's where that information is stored. So it's a far faster response time to make sure that your requests are met.
Jeff?
Yes?
When you go on that site, the confirmation comes up, you can print it off, you give them your email, it goes right to your email.
Brilliant. So there you go. You do get a confirmation right away by email. I knew it had to be that easy because everything else with them is seamless. The big thing with respect to this, and it's a point to drive home, is to talk to your family about this. We had an individual speak to us after Wednesday's presentation in Richmond Hill. Well, if I've registered my consent, what are the odds if my family disagrees with it when the time comes that they can change that pace? It has happened in the past. It continues to be a bone of contention with respect to donors and their families. The big point to drive home is if you've talked to your family about this, if this is something that you've expressed your interest in, they understand where you're coming from, the likelihood of your family then going against your wishes is slim to none. It's the families that are blindsided at the time of death or shortly thereafter. They might not be up to making an educated decision. They might just want to be able to get the situation dissolved and out of their hair as quickly as possible. But that's the problem, is if you haven't talked to your loved ones about this, and then it comes down to that time, you are giving them kind of the authoritative decision. And unfortunately, in those times of distress, no one is thinking clearly. And if your organs fall by the wayside, those are lives that could be saved. Those are lives that could be improved as well. How can my donation help other people? Obviously, the big point to drive home is organ donation saves lives. In most cases, it is the only treatment option for people whose organs are damaged through either injury or disease. With eye donation, it obviously restores sight after disease, injury, congenital blindness. For bone donation, it restores the mobility and prevents amputation in some cases. For the hearts, donated for heart valves, it can repair birth defects in children and other individuals. Skin donation can improve life-saving wounds from burn victims. Transplants not only save lives, but they return the recipient to productive lives. So this is an important thing for our government, for our employers, for everyone to understand. When an individual has received the gift of life, they're back in the community. They're back contributing to society through employment, through education, through awareness and advocacy. If I have indicated my decision for organ donation, will everything be done to save my life? The short answer is yes. But the big concern, and I get this all the time, is that this is probably a number 3 concern why people don't feel comfortable giving. They feel that the doctor will fight less to save their life if they're a registered organ donor. And it makes absolutely no sense. You're probably thinking in your head, well, how can they justify that through, the ethics of doctors these days? And if that individual, they think it's a number